Hi, my name is Narada Immaculate, and I'll be doing skills video on administering of the prothalamic medication to my patient. First and foremost, I gather my supply. I have my hand sanitizer, I have my gloves, I have my clean cloth, I have my small gauze, and I have the medication and some warm water somewhere. First thing that I do is I knock onto my patient's door, and then I close the door for privacy. After closing the door for privacy, I introduce myself to my patient. Hi, Mr. Smith, my name is Narada Immaculate, and I'll be your nurse today. And then after introducing myself, I ask for 2 identifiers. Could you please tell me your first and last name and your date of birth? And after they have told me their first and last name and their date of birth, I look onto their wrist to verify that actually it's the right patient. So after that, I tell them, hi, Mr. Smith, your health provider has requested I apply Temorai 0.25 twice a day, and I tell them what the medication does. The medication helps with glaucoma, and then also it helps reduce on the pressure that is being inserted onto the eye. So after telling them what it does, I again ask them if they have any allergies. They either tell me they have allergies or they don't. So when they tell me they don't have any allergies and they're okay to have the medication, I then tell them, I perform hand hygiene. After performing hand hygiene, I put on my gloves. After putting on my gloves, make sure that I put on my gloves. I then position my patient in a spinal position of looking up, slightly looking up, so I can be able to administer the medication. After doing that, I get a clean cloth or a wet, then I put it in warm water, and then I use my non-dominant hand, and then I hold on to the forehead, and then because usually it's clogged up or it has some glitches inside, and then from inside to out I clean it up, inside to out. Then I change onto the other side that is clean. I put it in water again, from inside to out. Clean it again. So after I've cleaned it up, and my patient is in a comfortable, I still ask, are you comfortable? And they tell me they're comfortable. After that, I take off my dirty gloves. I doff off my dirty gloves and then trash them in a trash can. After trashing them, I then tell them what I'm going to do next. So Mr. Smith, next I'm going to administer the medication, but I have to make sure that I follow the 6 rights of medication, and that is the right patient. I follow the 6 rights against the medication order that has been given to me by his health provider. So I make sure it's the right patient on the MA, and it's the right patient and the right patient on the medication. I make sure it's the right dose. I make sure that it's the right time, it's the right route. I make sure it's also the right documentation and the right drug. So after I've confirmed the MA against my medication and it's the right patient and the right dose, I tell them I'm going to apply Temorai 0.25. So after that, I again perform hand hygiene. After I've performed hand hygiene, I put on my gloves. Make sure that I doff on my gloves well. After I have put on my gloves, I use my non-dominant hand and my dominant hand holds onto the chin, onto the forehead, up, and then I use my non-dominant hand I open my drag, and then I use my non-dominant hand. I get one of the gauzes. So I make sure that I put the first gauze under the eyelid, and then insert some bit of pressure down below the eyelid, and then I get my Tamurai. I put in one drop, but make sure the drop should be below the eyelid, the lower eyelid. So I make sure that it has actually dropped in. In case it doesn't drop in, the drop doesn't go into the eye, or somebody blinks, then you repeat it again so the person can actually get the dose. Then I trash that. I get a second gauze, small gauze, put it under this other eye, and then insert a little pressure on it, hold the forehead, and then make sure that the eyelid, I can see the lower eyelid. Tell them to open the eyes so I can be able to see the lower eyelid. I get my dominant hand, and then I also drop in one drop, and then insert for like 20 minutes, 20 to 30 minutes, so it dissolves and I can see it. Remember, we have to do it below the eyelid, the lower eyelid, so we drop it in. So after that, after 20 to 30 minutes, I again trash, and then I doff off my gloves, and then cover up my medication, and then perform hand hygiene. After performing hand hygiene, I thank my patient. Thank you, Mr. Smith, for allowing me to do this procedure or administer the medication. And after thanking my patient, I position them well in a comfortable position, and then I tell them about the effects. They should know about the effects, or the adversary effects that can actually happen. Or Mr. Smith, you may feel some bit of dizziness, you may feel some little bit of you feel a burning sensation, or you may feel a little bit dizzy. And then when I tell them about the effects, so they get to know about the effects and they prepare their mind for the effects in case they are to happen. And then after that, I then perform hand hygiene, and then I document my procedure. Thank you very much.